My name's Angela. I'm 71 years old, and for at least 10 years I've been suffering with sciatica, and it was extremely painful from my hip down to my toes, actually. And finally I decided to have a consultation about it, and the surgeon suggested that I have an injection first to see how if that helped, but it didn't last for very long at all. And so then I came to see Professor Ranganathan, and he explained to me that basically this is how it's supposed to be. It's quite clear there. But on this side, this is where my nerve was trapped, and that's where I was getting the pain. So he explained to me that there are two ways of tackling the situation, and the first way was to have a regular operation and with and you'd end up having screws actually in your spine, which would make it very difficult to walk. And so in fact I thought that wouldn't really help my situation, since I was having so much trouble walking anyway, not enjoying my life at all, not being able to, go on. Well, I went on holiday with my children and grandchildren, and of course I spent most of the time sitting because I was in so much pain. So after that holiday, I saw Professor Ranganathan, and after he explained to me about the keyhole surgery that he has, it's very clever, it's pioneered, I think. And also the recovery is so much quicker, and that really appealed to me. The fact is, I don't know whether I'd want to go ahead with the previous way that he explained that surgery, or I think most other surgeons would do it that way. I'm convinced that this was the only way to go ahead. And I'm absolutely delighted that this is the second week since I had the operation, and I'm able to walk. I'm pain-free, and I'm told that in about 6 weeks' time I'll be even better. So I'm looking forward to that.
Carl, would you like to add anything?
Yes. How's my husband?
the improvement is remarkable, because prior to the operation, if we went for a walk, we had to choose a path where she could find somewhere to sit, and she would sit for 5-10 minutes. She'd try to walk again, and she would need to sit fairly soon afterwards. So it was becoming intolerable, her situation. So when we came to see the professor, and he explained fully what she was suffering from and the possible treatment, one was immediately eliminated in my mind, because it meant that it would be a traditional operation where she would take 4 to 6 months to recover, yeah. And also one wouldn't know exactly how well she would recover. He explained, however, that with keyhole surgery he could treat the problem, and the recovery period would be much less. So we discussed it, and we decided that that was the path that we would decide to follow. She had the operation. She came home the same day, and her recovery has been steady and very progressive. as she said, it's 2 weeks since the operation. She walks easily. She's not in much pain. And from my understanding, from what the professor says, is this improvement will continue, and we will see this progress to a point where the pain is almost eliminated. So it really was very fortunate that Angela found the professor, because the idea of her having to spend 6 to 8 months recovering, and at the end of that period, for us not to know exactly what form the recovery will take, it was wonderful, really wonderful that we had this encounter with the professor.